Listen to this. Something as routine as taking a blood pressure pill could send your loved one into a medical emergency, the very hospital meant to keep them safe. I'm not here to scare you. I'm here to protect you and the people you love, okay? What I'm about to share could mean the difference between a smooth recovery and a rapid response team rushing into the room. Well, this is the silent scandal no one talks about, but I've seen it far too many times and I can't stay silent. Hi, I am Nicholas, a pharmacy practitioner, and I've worked across hospitals and retail pharmacies, and I've watched this one tragic mistake unfold over and over again. So, it is not always the fault of the doctors or nurses. Often, they are following the system, but the system is broken. Today, I'm going to explain exactly what that mistake is, how it happens, and most importantly, what you can do to prevent it from harming you or someone you care about. This may be the most important conversation we have had. Let's paint the picture. Well, your elderly parent or your loved one hasn't been feeling well. Maybe they've been sick for a few days, not eating much, a bit dehydrated, and eventually they're admitted to the hospital. Naturally, their blood pressure is already lower than usual, okay? But here's the shocker. They are still given their usual blood pressure medication, 2 to 3, sometimes even more without adjusting the dose. Why? Because the system says so, because it is what's in the chart. And just like that, their blood pressure, already fragile, drops dangerously low. Then all of a sudden, their hands feels cold, dizziness sets in, disorienting begins, and maybe even unresponsiveness occurs. This is how hospital rapid response teams gets called, okay? I've seen it again and again. And it is not a rare occurrence. It is happening every single day in hospitals across the world. Just a quick pause. If you are tired of feeling stuck with high blood pressure, even while taking medications, I've created something just for you, okay? Well, what is this? It is called the 21-day blood pressure reset. And it's a simple step-by-step course to help you take back control naturally. Inside, you'll learn daily habits that actually work, like how to breathe, move, sleep, eat, and hydrate in ways that lower your blood pressure gently without side effects. It is made for real people, not perfect ones, and it's built with guidance from a pharmacist who understands what you are going through, okay? So, if you are ready to feel confident, healthier, and in control again, click the link in the description section below to start your reset today, okay? Let's resume our discussion. Let me break it down. Many people, especially older adults, take blood pressure medications at home, but when they get sick, dehydrated, or are in pain, their blood pressure naturally drops. Okay? Despite that, the hospitals often continues those same medications without adjusting for the current condition. Very shocking. It's like pouring water in a glass that is already full. Eventually, it overflows, and that overflow, in this case, is someone collapsing in the hospital bed. I've heard nurses say that the most dangerous time in a patient's hospital stay is 30 minutes to an hour after medications are given. Why? That's when rapid response happens, because that's when the damage from over medications shows up. So now that you know the risk, let me show you how to fight back respectfully, but firmly as a patient or a family member, okay? So step number 1, be the advocate. Make sure the hospital staff has the correct, up-to-date list of medications and dosages. Don't assume the electronic records are accurate, but double check, call the nurses, call the station, and confirm again the next day, okay? Step 2, monitor blood pressure trends yourself. Don't be afraid to ask their blood pressure reading at that particular time. If you see numbers like 102 or 105, that's already low for someone who is sick, okay? So be concerned and politely raise that concern to the medical team. Ask if it is necessary to continue all those blood pressure medications at that particular time, okay? So step number 3, watch for symptoms of low blood pressure. If your loved one is suddenly weak, lightheaded, dizzy, or says they feel like fainting, this is a red flag. These symptoms are not normal. Speak up, okay? It could mean the medications are dropping their pressure too far, and that needs to be addressed immediately. Here is something that gets missed all the time. When patients are discharged, they are often sent home on the exact same doses of blood pressure pills, okay? Even if their blood pressure is still running low. That's dangerous, okay? I can't tell you how many times I've had to lower those doses at discharge and instruct patients to follow up with their doctor and monitor closely at home. Because going back to full strength medication too soon can put them right back where they started or worse. I know this may have been hard to hear, but you need to know the truth. This is not fear mongering, it is prevention. It is coming from someone who sees the inside of this system every day, okay? This isn't about blaming healthcare workers. Many of them are doing their absolute best. This is about a system that favors routine over reflection, protocol over personalization. But you can make a difference. You can be the voice that protects your family from harm. You can ask questions and push for better care. Please don't let this happen to you or someone you love. If this message spoke to you, share it. Someone else may need to hear it too. And if you've ever had an experience like this, let me know in the comments, okay? I read every comment and I will appreciate it. For more practical advice on staying safe and healthy, check out other videos on this channel. Most importantly, stay informed, stay empowered, and we'll talk again soon, okay? Bye and be blessed.